this is Vartuin. Today I'm going to demonstrate how to change out an ostomy bag. So before I begin, I will gather all my supplies. First, I will need to pre-cut and place my ostomy and buffer. I will need a graduated cylinder, stomach guide, gloves, scissor, pen, skin prep, hand sanitizer, and also a couple of washcloths. So I will knock on the door. I will wait for my patient to invite me in, and I will go in, close the door behind me for providing privacy and performing hand hygiene. Introducing myself. Hi, my name is Vartuhi, and I'm going to be your nurse today. May I have your full name and date of birth, please? Thank you. Um, So today I'm going to be changing out your ostomy bag and wafer. It's probably going to take 5 to 10 minutes. Do you have any allergies? No? Okay. So I'm going to reposition you into flat position. So I've got a little easier area to work with. Do you have any question? No? Okay. So I verified the doctor's order. All right. I will get started. So I performed hand hygiene before. I'm going to put on my gloves. Okay. And I'm going to start by taking off the wafer. I'll undo the bottom. I I will empty that into my graduated cylinder. I will keep the clamp if necessary. If not, I will dispose of whole thing. So then I will move on. I've got to take off the ring, and I will just slowly peel from the edges, peeling away from the skin, not being harsh. Just go slow, away from the skin, peeling that back and up. Perfect. And then again I will dispose of that. Okay, first thing I want is to get some warm water and approved cleaning solution, and I will be cleaning around my stomach side. While I'm cleaning, I will perform an assessment. I want to make sure that my stomach is looking beefy red, that I'm not seeing any irritations. I'm looking for sign of healing, sign of breakdown, but the beefy red appearance is what I'm looking for. A little bit blood is okay, but a lot of is not. If I am seeing anything worries, so I would like to communicate that with my provider immediately. So I'll dispose of that, and and then I will dry. I will just pat dry around my ostomy. Perfect. Okay. After it's cleaned and has been assessed, I'm going to use my ostomy stomach guide to measure my ostomy. It has different circumferences that I can try. I want to get this tight but not so tight that it's causing damage to the ostomy or leaving too much skin exposed, because acidic bowel content will be touching the skin and can cause it to break down. So I'll start by looking 32 millimeters or one quarter. It's pretty good, but it's a little tight. So I'm going to move on this one. I mean 1, 3, and 8, and also every ostoma is different. But I think this is good quite for this one. So 1 and 38 I will use. So I'll take that white and I will grab my wafer. I'll put that up, putting the little tiny hole of the wafer in the middle of the dot, and then taking my pen, drawing around where I need to cut it. And then I'll cut my wafer out. I will peel the back of the before I place it down, but I can kind of do quick look to make sure it will fit. It looks good. So after that, I will get some skin prep and place it around the wound. That will help make a good seal. Okay, so I'm going to let that completely dry. Then I'm going to um, peel the adhesive off of the bag, and then I will place it down on my ostomy. I'm going to spread from the inside to the outside, making sure that I get a good seal. Are you okay, Miss Smith? Okay. Then once I've got that good seal, I'm going to grab my bag. I'm going to put it up, match it up, and when I press down, I should hear a clicking. Okay, and then my bottom is still open, so I'm going to fold that over a few times. This helps prevent leakage out the bottom, and I'm going to turn those clumps over to make sure that is good and sealed. Okay, so I've changed out my bag. I'm going to dispose of all of my extra supplies and going to remove my gloves, perform hand hygiene, and going to reposition my patient, and also going to give them the cow light. Okay, so thank you so much for letting me help you today. Do you have any question? Are you comfortable? Do you need anything else? No? Okay, that's good. So, and then I'm going to perform my hand hygiene, leave the room, and document my procedure. Thank you.